The family of Mike Beeler made the heavy decision to say goodbye after speaking with staff at a Vancouver hospital.
They said he's basically brain dead. Do you want us to keep him on life support, or do you want to pull the plug?
So our decision was to tell him to take him off life support.
A death notice appeared in the local newspaper. It remembered Michael A. Beeler, 60, of Vancouver, who died on August 9th, 2021.
That whole week was kind of a blur. I mean, trying to come up with funeral arrangements and letting family members know that he passed away. And
then came the phone call that no one expected. It was Mike.
And I said, "You can't be alive, you're dead." He goes, "No, I'm not. I'm quite alive."
Mike wasn't dead. Instead, he's very much alive.
I don't get it.
In a terrible case of mistaken identity that has never been publicly disclosed, KGW found PeaceHealth Southwest Medical Center in Vancouver allowed a family to pull the plug on the wrong man.
I'm going, you know what? We made life-ending decisions for a person we don't even know.
This medical mix-up all started with a 911 call on August 8th, 2021. According to dispatch logs, Mike Beeler's roommate was not breathing and unconscious after he choked on a piece of steak.
He fell over a chair, and I thought he was dead then.
An ambulance transported the man to PeaceHealth Southwest Medical Center in Vancouver. But somewhere along the line, the roommate was misidentified, and the hospital incorrectly treated him as Mike Beeler.
How do you misidentify somebody?
Beeler's family claims Mike had previously been treated at PeaceHealth Southwest Medical Center and had medical files on record, which may help explain why the hospital knew to call his sister and brother-in-law with dire news.
It was a nurse from PeaceHealth.
And later, a decision to make.
Was it a question?
It was a question of, do you want us to keep him on life support?
And that wasn't the only decision. The body was transported to a funeral home, where the wrong family was asked about final wishes, cremation, and organ donation.
And when we went to the funeral director, I says, don't we need to identify him? And there was never, no, we'll just take it from here.
All County Cremation and Burial Services declined to comment. It wasn't until Mike made that unexpected call to his sister a week later, concerned because his cell phone account had been closed, that anyone realized.
It's pretty bad, man. I mean,
the roommates had been switched at death.
And then the sorrow and all that stuff to go with it. And he's dead, and I'm supposed to be dead. Who knows what's going on here?
After learning about the mix-up, the Clark County Medical Examiner's Office said it retrieved the decedent from the facility where it had been sent, conducted an external examination, and used fingerprints to confirm the person's identity, which proved it wasn't Mike Beeler. It was his roommate. A new death notice was published in the newspaper remembering the roommate, David C. Wells, 69, of Vancouver, who did die on August 9th, 2021.
And if that isn't troubling enough, get this. At the time, nobody told the family of David Wells about the mix-up. The only mention of misidentification, they say, was in a coroner's report. They had no idea that their loved one was taken off life support by complete strangers until I contacted them, a reporter, nearly 3 years later.
I don't understand that lack of humanity. I don't.
They had ample opportunity to notify me, and they didn't.
We had so many opportunities.
Sean Wells says his father had a distinct tattoo on his arm, which could have raised red flags if comparisons were made between the patient and medical files.
It was pretty noticeable that it would have been a very easily identifiable mark on his body that, even if there was any slight confusion about his identity, I think it would have been quickly resolved.
Instead, a mistake was made, and the family of David Wells must live with the consequences.
I'm at a loss for words how badly they handled this in regards to my father, and I'll never be able to get that decision back.
Mike and his family have been met with silence, too.
I guess I still don't know whatever happened. And
So you don't know how this mix-up occurred?
No, not at all. And we never got an explanation. And we never got a sorry or anything.
PeaceHealth declined to answer our questions or provide any explanation about the mix-up, citing federal patient privacy laws.
Should a hospital apologize when a mistake is made?
Anytime something goes wrong in healthcare, it really is important that the practitioners and the organization proactively reach out to the patient and the family to let them know what happened, to explain what took place, and to apologize.
Dr. Thomas Gallagher, a patient safety and ethics researcher at the University of Washington, says when critical mistakes are made, hospitals need to go back and examine what happened. A PeaceHealth spokesperson wouldn't say if there was any type of internal review.
And so you can really tell pretty quickly whether organizations are committed to learning and transparency and accountability, or more interested in hiding things and protecting their reputation.
Mike Beeler's family thought they'd lost their loved one for good, taking him off life support, only to learn the shocking truth. It was a stranger, yet nobody will explain how it happened or why.